My name is Feng. I'm a postdoc from Stanford University in Dr. Robin Magetti's lab. We're working on clonal hematopoiesis, which is a pre-leukemic condition. And the clonal hematopoiesis happening when hematopoietic stem cells expand with somatic mutations. And here we're working on a condition called TP53-mutant clonal hematopoiesis. Why we're studying on it? Because TP53 mutant clonal hematopoiesis is enriched in cancer survivors who received chemotherapies and radiations, increase their risk for developing future leukemia and posing a significant threat for their long-term survival. And there's currently no effective strategies to target its clonal expansion before transformation. And here, my study is to provide a preventive strategy for cancer survivors who are at risk for future leukemia. I gave an oral presentation on my study. In our study, we established a TP53 clonal hematopoiesis model by using primary human HSPCs. We edited these HSPCs with TP53 mutation, and we observed TP53 mutant HSPCs only clonal expand after genotoxic treatment, which is faithfully mimicking the observation in clinic. We also identified a synthetic lethal target of TP53 mutation. DOCK1 is a synthetic lethal target for TP53 mutant mutation observed in primary AML patient data. And here, we targeted the DOCK1 either genetically or pharmacologically. It inhibited the clonal expansion of TP53 clonal hematopoiesis expansion. And we are currently investigating the molecular mechanism under this phenotype. TP53 clonal hematopoiesis has the greatest potential to transform to aggressive TP53 mutant blood cancers. Once transformed, these patients have dismal survival in months, and there's no effective therapeutic strategies for these patients except bone marrow transplantation. However, bone marrow transplantation may not be available for all the patients, may not be suitable for all the patients. So instead of posing these patients into great risk for future leukemia, we want to identify a strategy to prevent its expansion before transformation. So currently, clinicians in hematology oncology see patients who have TP53 mutation in their blood, but have no strategies to manage those clones until they transformed. So here, we want to develop preventive strategies to target this condition in those patients. We are currently investigating the molecular mechanism under this phenotype. And for me, I work on the research part but do not run clinical trials. But I will looking forward to see clinical implications on my finding.